Hello, everyone. Good evening for all of you. Today we will start the revision, the first pre-revision regarding to the exam, the KAPS exam for March, the coming March. Let me tell you about the schedule today. Just 1 second. Hello, everyone. As I mentioned, today we will start the first revision for the KAPS exam for the coming March 2023. Our schedule today, we will discuss many questions, many multiple choice questions related to the exam and from the previous records. Okay, we will start with a quiz, a small quiz. I'll send you this quiz in the pool to start to solve it. Then after that, we will discuss the questions regarding to the quiz and another questions. Okay, I'll launch the quiz now to start to solve it. Just 6 minutes, then we will start the discussion.
Just 3 minutes, then I'll end the quiz. Just 2 minutes, then I will end the quiz. Only 1 minute remaining, or less than 1 minute. Okay, I will finish it now. Okay. Now let's start the discussion. I'd like to welcome you again. Hello, everyone, for this first session of revision regarding to the KAPS exam, the coming exam, okay? Today, we'll discuss about 15 questions, part of them from the questions in the quiz that we started with it, and the other new questions, okay? Most of those questions from the recent recalls from the previous exams, okay?
I will make all of you mute, and I will explain the questions and explain the answer and the rationale of the answer. And please, if you have any question, any question regarding to what we discussed, please raise your hand and open your mic and ask, okay? Let us start. The first question today. All the following are enzyme inducers except. So we are looking for enzyme inhibitor. Which of those 5 choices is an enzyme inhibitor? Okay, let me put some summaries or some collections for the enzyme inducers and enzyme inhibitors. Okay, I know that it is difficult to remember all of them, but just if you put the following rules, you will remember them. Firstly, all anti-epileptic agents are enzyme inducers except. So all the anti-epileptic agents are enzyme inducers. Phenytoin, carbamazepine, phenobarbital, topiramate, all of them are enzyme inducers, except one of them, which is valproic acid. So directly, the valproic acid is an enzyme inhibitor, okay? Another collecting rule. All antibiotics are enzyme inhibitors except rifampin. So any antibiotic you have, you can expect that it is an enzyme inhibitor, firstly, except the rifampin, which is an enzyme inducer. Okay, so other drugs that you can know that it is an inhibitors, like calcium channel blockers, the non-dihydropyridines, verapamil and diltiazem. Okay, it is an enzyme inhibitor. Okay. Those will collect most of the drugs related to the inhibition and induction of the enzyme of the liver enzyme, liver microsomal enzyme. Let me revise about this point. What is the effect of inducer on the other concomitant drug? Inducer will do what? Inducer with the letter D will cause one of the 4 points. D, so it will decrease. Decrease what? Decrease the level of other concomitant drug. Decrease the T-half of the other drug. Increase the metabolism and increase the clearance. Okay, so it will decrease the level, decrease the T-half, increase the metabolism, and increase the clearance, while inhibitor doing the opposite. Inhibitor will increase the level, increase the T-half, decrease the metabolism, and decrease the clearance. Okay, so if you remember this point, you will answer any question regarding to the interaction between inducer or inhibitor with the other drugs. Let us solve this question. All the following are enzyme inducers except we are looking for enzyme inhibitor. According to the list that we mentioned, carbamazepine is an inducer. Phenytoin is an inducer. Phenobarbital is an inducer. All of them are anti-epileptic agents. Tobacco smoking also, it is an inducer. So that the remaining one will be clarithromycin, one of the macrolides, the antibiotic inhibitor. Okay. Let's see the second question. Tramadol acts on the following. Or what is the mechanism of action of tramadol? Is it norepinephrine reuptake inhibitor only? So that increasing norepinephrine level only? Or norepinephrine reuptake and mu receptor inhibitor? Okay, or mu receptor inhibitor only, or mu delta and kappa receptor inhibitor. Tramadol have some narcotic action, so it will act on mu receptor. It will block mu, it will be agonist on mu receptor as morphine and other opioids. But also it have some effect on the norepinephrine and serotonin reuptake. It will decrease the reuptake, so that increasing the level of norepinephrine. Therefore, the mechanism of action will be this one. Norepinephrine reuptake and mu receptor. Another common question in previous exams, the effect of aminoglycosides on the patient having kidney failure or renal impairment disease. Okay, a patient here having a chronic kidney disease and receiving gentamicin every 12 hours, 2 doses per day. What is the correct? What is the best way to adjust the dose for this patient? Generally, for the aminoglycosides, to adjust the dose, just increase the interval. Increase the interval to be once daily, not twice daily. Why? To decrease the exposure of the kidney to the aminoglycoside. So that any question you will have asking about this point for the patient having renal impairment and he should take any of the aminoglycosides, the adjustment will be increasing the interval to be every 24 hours. Okay. The next question. Conversion of nucleoside to nucleotide is achieved by the addition of double bond, sugar, purine base, ribose, or phosphate. Firstly, what is the difference between nucleoside and nucleotide? And what is the nucleoside? Firstly, nucleoside in the DNA and RNA is formed of 2 parts, base plus sugar. Okay, if it is DNA strand, what are the bases that present? Either adenine, guanine, thymine, or cytosine. Those are the bases that present in DNA. What is the sugar? Deoxyribose. This is the sugar. Okay. If we have RNA strand, what are the bases? Adenine, guanine, and instead of thymine, there is uracil and cytosine. What is the sugar? Sugar is ribose. Okay. The combination or the merge between the base plus the sugar will form the nucleoside. We called it nucleoside. So what is the nucleotide? Nucleotide is addition of phosphate. either monophosphate, diphosphate, or triphosphate. So here the answer will be phosphate. The addition of phosphate will convert the nucleoside to be nucleotide. A cancer patient is suffering from anemia due to his chemotherapy. Okay, which drug recommended for his condition? Which drug is recommended for his condition? In your answer in the quiz, most of members give the right answer, which is eputine alpha. But some of them answer as iron, which is a wrong answer here. Why? What is the reason of anemia here? Anemia regarding to the patient who is receiving chemotherapy. The reason here is not a deficiency of iron. The reason here is a deficiency of erythropoietin. Okay, this erythropoietin is the hormone that's responsible for synthesis of RBCs from the bone marrow. So that we have a problem in the synthesis. Therefore, we need an erythropoietic agents that enhance the synthesis of blood cells, the RBCs, which is eputine alpha, or what we call the darbiputine, the analog, the other analog, darbiputine. Those are the drugs used for the anemia, either related to the cancer patient or the chemotherapy administration, or another type, which is chronic kidney disease patient. Also, those patients suffering from the deficiency of erythropoietin, due to that erythropoietin is produced from the kidney. If the patient having kidney disease or chronic kidney disease, the erythropoietin level will decrease, and therefore RBCs will decrease, and the patient suffering from anemia. Okay. What about filgrastim? Filgrastim, it is a colony stimulating factor that help in synthesis of which type of blood cells? Of white blood cells. So we can use it to treat the neutropenia, whatever the cause. Mostly will be due to the chemotherapy administration. Okay, so the filgrastim is used to treat the neutropenia induced by the chemotherapy. Rituximab, it is one of the monoclonal antibodies that used as an immunosuppressant agent. Interleukin 11, or the drug called oprelvacane. Interleukin 11 also used for synthesis of thrombocytes or platelets. Therefore, we use it in the patient who having thrombocytopenia. Thrombocytopenia, the patient who receiving the chemotherapy and having a thrombocytopenia, so we can use oprelvacane or interleukin 11 for those patients. While iron plus folic acid for the other types of anemia regarding to iron deficiency and folic acid deficiency. The next question, vitreous humor is present in the eyeball. We have two types of secretions, aqueous humor and vitreous humor. Aqueous humor from the anterior part of the eye, anterior chamber, which is responsible for glaucoma. If it is accumulated in the eye, it will lead to glaucoma or increasing intraocular pressure. While the vitreous humor present in the posterior eye chamber. The posterior eye chamber. Okay? Those are the questions of the quiz that we distributed in the first part of this lecture. Let us see other questions. In DNA, if base sequence is A, G, T, adenine, guanine, and thymine, what is the complementary paired base sequence? The complementary here in which strand? DNA or RNA? He didn't mention, but here he means the complementary DNA strand. Adenine bind to which base? Adenine in the other complementary DNA strand, it will bind to thymine. And guanine will bind to cytosine. So if we have A, G, T sequence, the A with T, the G with C, and T with A, so that the complementary will be TCA. This one. Okay. Another question, which of the bases is purine and which of them is pyrimidine base? Here, the right one is purine base. This is the purine base. Two fused ring. One of them is 6-membered and the other is 5-membered, containing 4 nitrogen atoms. This is the purine ring. What is the pyrimidine ring? Or pyrimidine base? We have thymine, we have cytosine, plus uracil if we are talking about the RNA strand. This base or the structure of pyrimidine is a 6-membered ring containing 2 nitrogen. This is the pyrimidine ring. Let us see this question. MP is a patient, male. His old is 60 years old, with hypertension and treated with beta blockers. Okay, drug X and drug Y have the same mechanism of action. Both of them are beta blockers, the drug X and drug Y. Drug X is, the dose of drug X is 5 milligrams. Will produce the same magnitude of antihypertensive action as 500 milligrams of drug Y. So the dose of drug X is 5, the dose of drug Y is 500. What is the right statement regarding to those choices? Drug X is about 100 times more potent than drug Y, or drug Y is about 100 times more potent than drug X, or drug Y is less efficacious than drug X, or drug X is less efficacious than drug Y. Here we are talking about similar efficacy. We have two expressions, potency and efficacy. Both of them, X and Y, having the similar efficacy. They will give the same effect. Okay, but the dose needed to give the effect from drug X is 5 milligrams, while the dose needed to give the same effect of drug X from drug Y is 500 milligrams. Therefore, the drug X is more potent than drug Y. And we mentioned that 100 times more potent than drug Y. Therefore, answer number A is the right answer here. A patient has been prescribed a combination of clopidogrel plus aspirin. For which indication? To protect against any coagulopathy happened. Protect against stroke, transient ischemic attack, protect against myocardial infarction or any cardiovascular disorder. This indication in patient who have had, which indication the patient will receive both or this combination. ST segment elevation, myocardial infarction, post-MI with stent, for sure, this is the indication. Congestive heart failure, no, it is not the indication for this combination. Acute stroke, no, we will not give for acute stroke. We will give them for prophylaxis from the stroke. Prophylaxis to have the next episode of stroke or stroke after that. Also transient ischemic attack. Stable angina. It's not the drug for angina. So that the right answer here will be ST segment elevation myocardial infarction post-MI, after the MI happened. For this one, it is one of the calculation problems. Let us see it. If a drug infusion rate is 750 milligrams every 6 hours, and the clearance is 8.3 liter per hour. Okay, so we have infusion rate 750 milligrams per 6 hours. Okay, and the clearance rate, total clearance, equal 8.3 liter per hour. What is the steady state, CSS? This is one of the pharmacokinetic calculation problems. As I mentioned in our lectures previously for the calculation of the pharmacokinetics, we have two things you should remember them in the pharmacokinetics to be easy to solve. What are those? First thing is knowing the formula. Knowing very well the formula that you will use. The second thing is the units. Adjustment of the units to be, all of them are similar units. Similar units of weight, similar units of volume, similar units of time. Okay. Here we have two information, the rate of infusion and the clearance rate. And he wants to calculate the CSS, steady state concentration, in this unit, milligram per liter. What is the formula that can we use, or that we can use in this problem? The relation between CSS and rate of infusion and clearance rate, this is the relation. CSS equal R over total clearance. Can we just divide the 750 over 8.3? You will have a wrong answer here. Why? Because here the units are different. The unit of the weight is milligram. It's okay. Here we have milligram. The unit of the time here is 6 hours, which is not like this. Here we have 1 hour. So we should make this every 1 hour. How? 750 milligrams every 6 hours. So how many milligrams every 1 hour? We should divide firstly 750 over 6. It would be 125 milligrams. This is the amount administered per hour. Okay. The clearance, here we have liter, the unit of the volume with liter, and here in the concentration with liters, so there is no problem. Now we can use the formula. Just divide 125 over 8.3. This would be 15 milligram per liter. Okay, this would be 15 milligrams per liter. This is how can we solve any pharmacokinetic problem. Please, first thing, knowing the formula that you will use. Second thing is adjustment of the units and check that all units are similar. Okay, let us see the next question. Sorbitan monostearate. What is the sorbitan monostearate? It will give oil in water emulsion or water in oil emulsion, or it is an anionic surfactant or cationic surfactant. Firstly, sorbitan monostearate is the SPAN. It's called SPAN. SPAN is non-ionic surfactant or non-ionic emulsifying agents. So this is a wrong answer and wrong answer. Is it giving oil in water or water in oil emulsion? According to the HLB system, it is lipophilic. It is lipophilic surfactant. So it will give water in oil emulsion. If we use it in oil in water emulsion, it will cause craning or separation between phases. It will destroy the emulsion. Okay? The next question. Steady state concentration achieved when? Either the amount absorbed equal the amount excreted, or the clearance rate more than the absorption rate, or the infusion rate more than clearance rate, or the protein binding is extremely high. Yes, to achieve the steady state concentration, both rates should be similar. The rate of absorption and the rate of elimination, both of them should be similar. So this is the right answer, number A. Okay. While what will happen if the clearance rate more than absorption rate? This will affect the T-half of the drug. It will be decreased, low T-half, and the drug will remain a short time in the body. What about if the infusion rate more than the clearance rate? The T-half will increase. Also, if there is a protein binding extremely high, this means that the drug will remain in the blood for a long time and the T-half will increase. Which increase the risk of pyelonephritis. Okay. Pyelonephritis is the infection of the kidney, bacterial infection of the kidney. So, which of those is the risk factor? We have many risk factors. But regarding to the choices, hypertension, hyperlipidemia, diabetes type 2, or male gender. It is diabetes type 2. And here it is female gender, not male gender. Female gender more susceptible to pyelonephritis more than male. So the answer of this question is diabetes type 2. This is the common risk factors developed for pyelonephritis. Include renal calculi, urinary tract catheterization, pregnancy, diabetes mellitus type 2, and benign prostatic hyperplasia. Those are the risk factors of pyelonephritis. the erythropoiesis take place in? Erythropoiesis, what is the meaning of it? It is synthesis of RBCs in the kidney or liver, bone marrow, or thymus. Okay. The kidney is the source of erythropoietin, but it is not the place of erythropoiesis. The erythropoiesis happened in the bone marrow. Let us see the last question today of this revision. In moderate exercise, all happened except if the patient having moderate exercise. Which will happen? Increase cardiac output, increase TPR. What are the TPR? They are temperature, pulse, and respiration. Decrease blood flow to the viscera. Increase diastolic pressure. All of them will happen except the last one. Except the increasing of diastolic pressure. Diastolic pressure will not be affected by moderate exercise. Why? The cardiac output will increase. The heart will do more effort, so cardiac output will increase. The temperature of the body increase. The pulse will increase. There will be tachycardia and tachypnea or increasing respiration. The blood flow will increase due to the increasing of cardiac output, so that the blood flow to the viscera will increase, while the diastolic blood pressure will not increase. Here, the blood flow to the viscera will decrease because the blood going to the muscles more than the viscera. Okay? This was the last question today. Still, we have another 4 revision lectures according to the schedule that I sent previously, and you can see the schedule in the website. And for full revision, please visit our website www.newptech.com or contact me on the WhatsApp number to know how can you join the full revision for the KAPS exam. Finally, I'd like to thank you so much about your attendance, and it is of my pleasure to receive your question regarding to this lecture or regarding to any of parts regarding to the KAPS exam. So we can open the discussion.
Thank you so much, sir.
Yes. If you have a question, please share it with me. No, any question? Okay, thank you. Thank you again. Thank you very much again for your attendance. I hope it was a useful lecture, and I hope to hear you in your feedback about this revision. And if you need anything or if there is any concern about the revision, please send it in the groups. Thank you so much, and see you in the coming revision. Goodbye. Thank you.
Thank you.
Bye-bye.
Thank